Hello, everybody. This is Tali, Berman, autism specialist, and here we are, three members of the Whole Child team who work with families through our Whole Child package, offering both biomedical and therapeutic interventions. And I'll let everyone introduce themselves. Patsy, you want to start?
Sure. Hi, everyone. My name is Patsy Giarda. I'm a registered nurse practitioner certified in primary care pediatrics.
Great. And Roni?
Hi, I'm Roni Antimis-Soker, individualized biomedical nutritionist.
And so if any of you don't know, Roni and I work together with families, providing them with ongoing guidance from a biomedical and therapeutic perspective. And Patsy really helps identify through the lab testing what exactly might be the underlying medical issue so that it can be treated. And so we are having a couple of different videos hitting we're talking about three different challenges that children with autism might have. The first was Candida. We talked about methylation last, and today we're talking about Clostridia. So Patsy, can we start by first telling us what Clostridia is?
Sure. So Clostridia is a type of bacteria that is considered dysbiotic or not helpful in the GI tract. The way that a healthy flora will do good things and beneficial flora such as probiotics, Clostridia is the opposite of that. It can cause negative reactions in children and adults.
Okay, so actually that leads us right into the next question, which is, what are some of the negative things you might see? What are some red flags? What might indicate that a child might have Clostridia?
Sure. So some of the physical things that we'll see, physiological things that we'll see with children or adults with Clostridia is changes in stool habits. Oftentimes children will have looser bowel movements, more runny, they'll end up with some bloating, GI discomfort overall. And then some behavioral things that I will see with children in cases of Clostridia are behaviors such as spinning. They will have a little more aggression.
Spinning or spinning?
Spinning, S-P-I-N-N, S-P-I-N-N-I-N-G.
Spinning themselves.
Yep. Spinning themselves, doing repetitive behaviors in that way, whether it be spinning or wanting to play with a certain toy repetitively. I will see that quite often. And also just a dysregulation of play. Parents will describe that their children are not playing in the typical way that they would, that they're not either uninterested in playing or just lack of interest in play in general is something that I'll hear quite often.
Now, would you say that this would be something that where, let's say, a child maybe wasn't spinning or was really engaging in play, and then it might be a little bit more obvious that there was a shift in that? What if a parent reports that they have a child who that's sort of been the way that they are for quite some time? They can spend the last year or so spinning or disinterested in play. Is it possible that someone could have, like a child could have Clostridia for a period of time left untreated, and so that's become the way that the child behaves on an ongoing basis?
Sure. So a lot of parents will describe that as their normal. However, we know that neurotypical children often will not spin themselves, or that they enjoy engaging in play either alone, side-by-side play with other children, depending on their developmental bracket, or engaging in other children with play. So it's something that I will test for, even if that's the parent's normal for the child.
Mm-hmm. Got it. And just a follow-up question: when you say spinning, does that also include a child spinning something, like spinning a tire or spinning a toy, or just if they're spinning themselves?
Both. So it's definitely both. Both can be considered red flags for Clostridia.
Okay, great. Roni, do you have anything you want to add in terms of red flags for Clostridia?
I think Patsy covered it very well.
Covered it. Okay. How does a child get Clostridia?
So a child or an adult can get Clostridia a few different ways. So one of the more common ways that we will see children having Clostridia is through frequent antibiotic use. When the healthy flora is eliminated from the intestines, Clostridia can develop an overgrowth. So that is one way. Another way is through lack of diet. And lack of, so diet as in unhealthy foods, more foods rich in simple carbohydrates, not enough fiber, not enough healthy fruits and vegetables, or a lack of healthy fermented foods. So healthy fermented foods or probiotics, yogurts, kefir, sauerkraut, those are healthy ways to add beneficial flora to the GI tract to outnumber any growth of Clostridia.
Okay, so just correct me if I'm wrong. So I'm trying to understand. So Clostridia, similar to Candida, is sort of always present at a certain point, but then it's an overgrowth issue, or typically in a healthy gut, there's no Clostridia?
Typically in a healthy gut, there's no Clostridia. Okay. So it's something that we typically do not want to see there. And if we do see it, we will treat it.
Got it. Okay. And so what is the testing for Clostridia?
So testing for Clostridia is typically done through a comprehensive stool analysis. Mm-hmm. So the comprehensive stool analysis will give us a culture of any dysbiotic flora that is present. And then I also like to do a urine organic acid test as well. There are metabolic markers for Clostridia that will read normal or elevated on that urine screening as well.
Okay, so it's the same similar test that you would do for Candida, if I'm not mistaken.
Yes. Mm-hmm.
Okay,
Yes,
so it's nice to know there's certain labs that can be done that you can really identify several things at once, the absence of or the presence of. So parents can really get a sense of several different things through, one or two different tests.
Absolutely.
And so then what's the treatment for Clostridia?
So Clostridia, I find, is more of a diet change. It's more of an impact of healthy flora. I like to treat with very high dose lactobacillus probiotic, and oftentimes in excess of 50, 60 billion, which is very high comparably to over-the-counter probiotics. So we go a little more strong on the dosage for that, and we see better success with elimination of the Clostridia that way.
Okay, and then would you often, with families, then do another retest to see if that took care of the issue, or do you do it sort of based on behaviors to know if Clostridia is now gone?
I do always recommend a retest. Mm-hmm. Oftentimes we're doing a few different treatments or behavioral therapies at the same time. We like to know what is being most effective. So if that Clostridia was successfully treated, then we can know that the child will more than likely need to remain on that high dose lactobacillus to help prevent reoccurrence in the future as well.
Okay, great. So then I'd love to hear a little bit about what you can expect to see once Clostridia is treated. What kind of changes that either one of you, we'll start with you, Patsy, have seen in children where this has been treated for them successfully?
So I've seen better regulation in bowel movements, more normalized stooling, whether it be less accidents, more regulated formed bowel movements, and then also better behaviors. So children are not often as distracted with the spinning of objects or spinning of themselves, and they're better able to functionally play either independently or with other children.
Okay, great. Ronnie, anything you want to add to that in terms of changes that you've seen with kids?
I was going to add that with certain strains of Clostridia, also aggression, I'm sure Patsy's seen this too, can go down quite a bit. And there's been some interesting research on that as well. So definitely seen that happen.
Interesting. Okay, so that wraps up this third video, which is on Clostridia, and I really want to thank you both for sharing your information and experience, because there's a lot of behaviors that can be really challenging and mysterious, whether it be aggressive behaviors, whether it be changes in stools, physiological symptoms, but also behavioral symptoms. And if anyone who's listening, just so you know, what we do as a team together with Dr. David Berger is really walk you through the process of literally understanding what are the tests that you can do, what tests make the most sense to do based on history, based on symptoms, what the results of those tests are, and then therefore how to do proper treatment so that any of these symptoms we talked about, and we talked about quite a bit, it was spinning, it was disinterest in behavior, it was disinterest in play, lethargy, aggressive behaviors. A lot of those things have underlying medical issues that can be treated, and once treated will allow your child then to move on to learning other skills that are important for them to live their best life. So thank you for your time today, and we hope for any of you parents, You gained quite a bit from what we had to share. And anyone who's interested in learning more about our whole child package and would like to sort of be supported through a process like this, the link will be listed below the website, and we would love to support you and guide you to help your child turn their potential into reality. So thank you, Patsy, and thank you, Roni.
Thank you so much, Patsy.
Thank you,
Tali.
guys.
All right,
Bye.
take care. Bye.